So as I was saying, I'm Anya Brickman-Raridan. I'm the president of the Affordable Housing Institute. For those of you who are not familiar with us as an organization, we're based out of Boston. We focus, as our name suggests, on affordable housing, a mix of policy, finance, community engagement, all with the goal to improving housing ecosystems, as we frame it, around the world. And we do work both domestically and internationally. Today, we're going to be focusing primarily on our domestic work and specifically the Health Secure Housing Initiative that was started and invented by our CEO and founder, David Smith, who is unfortunately not able to join us today. And he began thinking about these ideas of health secure housing essentially in response to the COVID-19 pandemic. But of course, the underlying issues and challenges of equity, of housing, of health, of communities being based in their housing expands beyond COVID. It just became something that everyone was a lot more aware of in the last year as we moved to work from home, as students became, home became school, home became work, home became everything. Suddenly everyone realized, if they hadn't already, as I'm sure many of you did, that home and housing is at the core of people's lives. So the focus of today, in addition to the Health Secure Housing Initiative broadly, is the work we've been doing in Milwaukee since last October, which has been supported by the JPB Foundation. And this has been work with a number of community leaders in Milwaukee and communities in Milwaukee, which has started to coalesce into the Park Cooperative Initiative, which is a localized collaborative effort to build healthy homes, home ownership, and opportunities for equity and equality within Northwest Milwaukee. So starting from this idea of health secure housing and building out into what does that mean for a whole neighborhood, for a whole community, and with equity at the core of those discussions. We have two wonderful speakers with us here today who know much more about this initiative than I do because they have been intimately involved with it from the start. The first is Wayman Winston, who we are also honored to count as a member of our board of directors. Wayman has been in the affordable housing space for many, many years, starting as part of a community development bank at South Shore Bank in Chicago, and going through a winding path and eventually ending up most recently as the executive director of WHEDA, the Wisconsin Housing and Economic Development Authority, where he spearheaded a number of very important programs, including Transform Milwaukee, which was and is a public-private initiative focusing on restoring the economic vitality of Milwaukee and many of the neighborhoods that are now being incorporated into the work we're doing today. Wayman has also served on the Governor's Task Force for Minority Unemployment, Wisconsin Council of Workforce Investment, and many other important and interesting organizations that have focused on equity and housing and economic development and their core. Joining us as well is Lamont Davis, who is the CEO of KLD Construction Management Services, among other roles, as I understand. He also has been co-founded Community First, a leading housing rehabilitation organization in Milwaukee, and then served as its program director for many years. And currently, in addition to helping and serving as an advisor to us on the Milwaukee project supported by the JPB Foundation, he's working with the Community Development Alliance of Milwaukee, which is a partnership with the city that was founded in 2011 to increase cohesion across city development sector and economic development sector in Milwaukee. And he has spearheaded the focus on maintaining Black and Hispanic ownership in the city, as well as the preservation of affordability for low-income workers and reducing eviction rates in certain segments of the city economically. And this has been in partnership with the city, with the county, and with WHEDA that I mentioned earlier. So very experienced Milwaukee residents and engaged members of the community here and leadership. And with that, I will turn it over to Wayman. We will have about 20, 25 minutes of presentation and then open it up for discussion. Please feel free to put comments in the chat as the presentation is going on. I will do my best to track them. And when we open it for discussion, if you're comfortable, we'd love to see everyone's faces and have this be an open dialogue. So please feel free to turn your cameras on and raise your hand or continue to put questions in the chat, and we will moderate the discussion from there. So Noah, I think you have the slides, and Wayman, the floor is yours.
Thank you, Anya, and good afternoon to everyone. Before I go into the slide, what we're going to cover today is really the work that began when the Affordable Housing Institute engaged 14 Milwaukee experts and leaders at the neighborhood, community, and civic engagement, where we asked if they would take the leadership in doing three things. Selecting a neighborhood that we could focus on, and the JPB engagement is to create a national model for neighborhood transformation of an African-American community. The second was we asked the leadership to recommend and decide on a set of uplift initiatives. You might call it what might be the programs, and then third, to advise us on the capital stack. And as Anya talked about, this work is also integrated in the early work that David Smith did around this whole idea of the intersection between housing and COVID and the conditions in both African-American and other communities of color, where we've seen the amplification of the illnesses, death, and infections by COVID, of which housing is one of the vectors there. So Noah, the first slide, please. One of the things that David began his work on last year was to pose this question of, could we have health secure housing? And the reason for the need for health secure housing is that as soon as the pandemic began in our country, it became very clear, starting in places like Milwaukee, Detroit, and other cities, that African Americans were particularly impacted. And that was true of other people of color. And that impact has been described by some people as a syndemic. That is the synergy of health conditions, segregation, redlining, the lack of health infrastructure in that community. On top of that, infrastructure of illnesses became the pandemic, and they argued that we should be describing this as a syndemic because all of these factors have simply amplified those legacy systems, resulting in greater infections, greater illnesses, greater deaths. And so this idea of addressing COVID, as important as it is as important to address having strategies for accessible public health. Next slide, please. When you look at this map, you see the legacy of the 1937 redlining map that begat the built environment that occurred after World War II, that basically defined where Black and other people of color could live. And that begat the 2018 map that shows you the home ownership within these communities. And you will note those predominantly communities of color have very little home ownership, resulting in that by 2019, Milwaukee had the second lowest home ownership rate in the country. And that that rate, when you put it in the context that Wisconsin as the state and Milwaukee as the city has some of the lowest cost housing in the country, that the fact that you had so few African Americans own homes in a community where one should be able to buy a home, I viewed as a cardinal sin. And it is in part because of this coming together of redlining, social conditions, And then the last map overlays asthma, and you see the red there showing acute asthma. And asthma is one of a number of the vectors that are bundled with COVID, including hypertension and diabetes. That trifecta was part of what was causing the increased deaths, infections, illnesses, and even the follow-along illnesses that people to this day are still experiencing, even though they've gotten over the COVID infection. And so what this is saying is that while we had fair housing in '68 and we had emancipation in 1865, we still have these legacy systems of housing and planning and zoning that embedded those biases and inequality, and we live in those communities to this day. Next slide, please. And density and overcrowding was another factor, of which overcrowding being the biggest part of that. And overcrowding typically has meant the oldest housing that tend to have lead paint, but you also have among this population higher levels of eviction, and those higher levels of evictions have typically translated in overcrowding, where family members, when their brothers and cousins and others lose their jobs, lose their home, they make room for them. And the result of that overcrowding, where you simply have too many people in a space, is one of the major vectors that translated into higher levels of COVID infection. And of course, this overcrowding of Blacks with poor housing, doubling up, evictions, all of that working to create the combination of both social and health conditions that we see today. Next slide, please. I think the next one is yours, Lamont.
Oh, thank you, Wayman. Thank you, Anya, Dave, and Noah for facilitating this discussion, and also to David Smith for inviting me to be a part of the local advisory group. Milwaukee has some challenges, and recently we've become a magnet for out-of-state investors. And here's a good slide that shows you why. In some of our neighborhoods, the capitalization rate, or the rate when you pay off that unit of housing, is up to 26%. So in 4 years, someone will pay off that unit. Here in Milwaukee, we have a scarcity of rental units. My work shows that we need about 40,000 rental units and probably about 30,000 new home ownership homeowners. And our rates have been declining for decades. It's not anything new, but what is new is this corporate landlord as a new phenomenon. It started in America about 10 years ago. And what we're seeing is that large scale investors, sometimes corporations, other times just out of state investors, they're buying up all of the inventory that's available. They can come into the market and they can outbid homeowners. They're pushing the dream of owning a single family home even further and further away from people of color. And they're also even starting to affect the naturally occurring housing that Wayman started to, naturally occurring affordable housing that Wayman kind of mentioned. When you have a mom and pop or a family member who rents out to a family member, and now we can't get those same easy wins in the neighborhood. I think what we see is that in Milwaukee, we've seen an increase in the rental units. And after the Great Recession, what we saw for every 3 owner-occupied units prior to that, only 2 returned. So we lost about 33% of those units. And Milwaukee has relatively cheap housing. The average value of the house in Milwaukee is probably less than $50,000 in these neighborhoods. We have a pro-landlord legislative body who doesn't want to regulate as much as they should, but we need to think about this, and tenants should have a right to counsel. They should have, when they're facing eviction, they should have rent correlation rates, or even some taxation may be needed to help on these rental units so that we can put programs in place that's going to help those renters be able to rent affordably. Next slide. So when you look at these corporate landlords, this slide shows you how they operate. In Milwaukee, for example, we had right now we have about 14% of our rental units are owned by out-of-state investors. That's really a tragedy. But the real danger is if this is left unchecked, these type of investors can corner the market and drive up the overall rental prices across the board. And this is more reason why we need to push for true affordable housing, whether it's naturally occurring or even just subsidized housing at this point. But definitely, Wayman mentioned before, we've seen a pronounced decline in the home ownership rates of people of color. And we need to really push that forward and move the needle on the number of people who are able to buy homes. Defeating the corporate buyer is going to take some work. But one of the things that we can do is we need information on these bulk purchases. These corporate buyers will swoop into town and buy up 13, 20, 50 units at a time. And often no one knows about it until the sale is already done. Again, I mentioned, support for tenant rights. How can we help tenants be able to navigate this phenomenon? Is there local information that's readily available for tenants? Right now, there isn't. We need proactive regulations so that we can promote the common good. So what I'm saying is the government needs to be involved. They need to provide oversight. They need to provide enforcement. And it could be groups like the Consumer Financial Protection Bureau. It could be the Fair Housing Councils. And then we need other supports like creation of community land trusts and land banks that are going to be dedicated to affordable housing. Hopefully what we can do is we can generate support to create resources for low-income households. And we've seen that in Milwaukee, where prior to the pandemic, we only had about $300,000 that was available for eviction prevention. Under the pandemic, we probably saw that amount go up to about $10 million, and that money is expiring in June. So we definitely need some support for tenants to be able to pay security deposits, be able to pay that rent when things get tight, and hopefully maintain their rental situation or their home ownership situation. Next slide. Oh, back to you, Wayman.
Thank you, Lamont. And picking up on Lamont's comment, the corporate buyers of housing are having impact nationally in your markets also. I've seen reports that saying that these corporate buyers are now compressing the rate of home ownership nationwide because of the volume of housing they bought. The last report I saw indicate that corporate and buyers are purchasing 1 out of 6 new homes, meaning they're crowding out homeowners, of which these homes will never have a homeowner in them. And then the report, the data you see, here's the work we've done. And above this work, Milwaukee is probably the poster child for the worst economic, social, and racial conditions in the country. We've already talked about home ownership in those items, but you also have a major study that was done the last quarter of 2020 where it compared the city of Milwaukee and its region with 49 other regions across 40 indicators. And Milwaukee was at the bottom of 90% of those indicators. And the author basically described Milwaukee as the 21st century Birmingham, Alabama. And if you remember the role that Birmingham in the 60s called Bombingham, and the role it played as a visible stop to the normal progress of African Americans participating in society, Milwaukee is playing that role in the combination of having 5 successive decades where African American income were lower at each of those decades than at the beginning. One of the highest levels of segregation in the country, and let me define what that means. Most white Milwaukeeans live in neighborhoods of 4 to 6 square blocks where there is no people of color. So you have neighborhoods surrounding the city that are virtually 90+% white. You have some of the highest levels of redlining and disinvestment. And we've already talked about the role of the investors, where in the lowest income property, they're getting cap rates of 26%. Those same conditions showed up in our Parks Cooperative Initiative area, and we observed 6 challenges to having healthy communities, including capital bypassing our community. Some cases that's redlining. In other cases, many of you may remember a couple decades ago when HUD established policy that if you had an oil tank, they wouldn't underwrite that property because it was considered an environmental issue. Well, Milwaukee was a community of oil heating. And so by setting a loan policy that said you would not underwrite a property that had oil tank, and this was where you're converting from oil to gas, it basically meant that you had outlawed a whole segment of the population in Milwaukee as well as other cities. Health improvement strategies are disconnected. Homeownership can't tap into cash to improve their property. So existing homeowners simply don't have ways to make needed repairs or make improvements to expand their property. And the community economic health of the community is declining. Coupled with that decline is that the health infrastructure is in short supply, meaning there simply is not enough medical infrastructure in the Parks Cooperative area, or for that matter, for the larger African-American community of which our target area is part of. And last, there is no institutional agency that can bring the residents together to affect change in their community. You either have the city, county, or tend to have small community groups. There is nothing in the middle that can bring together both community, economic, social, neighborhood to combat these issues that are affecting the community. And I would argue that one of the things that I've learned when I look back across these moments we've been in, 1865, new construction, 1968, civil rights, and today our George Floyd moment, the lesson has been that in every single one of those, there were no institutions that were there that had the primary responsibility when the federal government left to continue the needed work to improve African-American and other people's community, other communities of color. Behind these 6 observed challenges in our park cooperative initiative area, we realize that they are interconnected. Again, that term of syndemic, they're working synergistically so that these 6 factors, when they come together, amplify each other, which results in even greater harm. And behind these 6 challenges, we have begun to build explicit strategies and approach to combat these challenges that the community has. Next slide, please. So health secure housing is a tool for equity for Milwaukee. It will help address the fact that capital has bypassed African-American communities. It will help address a fundamental issue of the wage economy of Black Milwaukee. Something that is never talked about is that Milwaukee was the prototype for the welfare to work. The partnership between Republican Governor Thompson and Democratic President Clinton. When Lamont talks about those 31,000 very low-income renters, those were formerly people who are on welfare, who are now working with average income of $11,000. Income so low that their wages do not provide enough to keep a roof over their head, food on the table, or shoes on their babies. And so without addressing both capital and how we can improve income, we simply can't turn these issues around. Next is the health indicators. Milwaukee has one of the highest African-American infant mortality, a legacy of teen pregnancy, low birth weight babies. All of these speak to the lack of adequate health infrastructure and institutions serving this population. what we have seen has been, just like on the retail, where as a community began to transform, it operates as two positives to a magnet and look to move away from that African-American community. So much of the hospitals that used to be in the city are gone. They're now on the edge of the city. So if you want to get medical services, you have to go significant distances. There are only, on the north side, only 2 qualified health institutions. And so this lack of infrastructure is a major basis of why we have such horrible health indicators. We've already talked about the racial separation, America's form of apartheid. Milwaukee has the lowest African-American suburbanization in the country. And at the same time, it has the largest number of African-Americans with 6-figure income, where a fifth of their neighbors are in poverty. Lastly, housing poverty is at the core of the challenge. And that is that the wage economy has failed African-American consumers. And if that doesn't change, it does not bode well for Milwaukee neighborhoods. It doesn't bode well for the city. And these same factors are occurring in African-American and communities of color everywhere. And I would argue our democracy cannot operate where a significant segment of the population are at the edge of the economy, at the edge of our institutions, and don't have the rights of our Constitution. Thank you. Next slide. Bringing health secure housing to Milwaukee. One, obviously, is we need to have preventive health care, and we've talked about that. But primarily, what we are focused on is what we've learned from 1865 to now. What has worked and what has not worked for African-American communities. The importance of building a sustainable institution controlled by residency to give them the agency to guide the direction of their neighborhood. In this case, we're recommending from the Milwaukee Advisory Group, a mutual aid society, a model that Americans have used over countless generations to pool their resources and to bring about self-development and self-realization of their dreams instead of relying on others. We're proposing a collective impact structure, recognizing that those 6 conditions that we talked about and their synergy is bigger than what one person can take alone. And so our collective impact will have an institution controlled by residents, but will allow existing institutions and organizations to plug in, as well as new initiatives and organizations to plug in, so that we have the ability to grow the number of players that can put a shoulder to these intractable problems to date. And lastly, we've integrated and embedded healthcare and strategies to deal with pandemics, whether it's COVID, into the transformation model that we're developing. We'll stop here. Our next webinar, I hope, will be to be able to describe to you the institution and how it is working to accomplish the goals of creating transformation of both home ownership, racial inequality, and improved healthcare. Thank you.
Thank you, Wayman and Lamont. Lots of food for thought there, and lots of energy I'm sure everyone can feel, and passion as to the importance of this work and the potential for this work. So give people a moment or two to think about questions, unless anyone has a burning one they want to throw on the table right now. But we'll move into open discussion here. And one thing I think I wanted to kind of extend the conversation in, and builds well off of where you just landed, Wayman, is how do we ensure that the work that is occurring in Milwaukee right now with the Parks Initiative and this advisory group, how do we ensure that this continues beyond just the initial focus and sort of response period of COVID, the latest crisis, the money that's there to support that? Obviously, these are deeper seated issues, and these are
Right.
longer term initiatives, and longer term solutions are going to be needed. How do we think about grounding this work so that it can sustain?
We need to, with our talent and leadership team, we need to create a new type of institution. One of the things that when I joined this effort, one of the things I said to AHI, I was 14 years old when the Kerner Commission came out. And in 1968, as a 14-year-old, I thought many of these problems we're facing today would be solved. And when I look back on what occurred, really your question, Anya, not unlike our George Floyd moment now, where there's been a recognition by our nation that things aren't right and that every American has not had the ability to have a piece of the American dream. And right now, I think the last number I saw is that American corporations and foundations have committed $100 billion to racial equality. And if you go back to 1968, during the civil rights period, you had a similar reaction. By the 80s and 90s, most of that money was gone, even the good programs, even the exemplary programs. And what's left, whether you go back to after the Civil War, historical Black institutions and colleges, where the institutions were created, they're still there. The programs that were alongside of them are gone. In the 68 period, you had all these programs, they're gone. Those programs like the National OIC that focuses economic development and job creation for communities of color, those institutions, they're still there. And so the lesson for me and what I convey to my colleagues and I convey to all of you is that if you do not have institutions that can operate beyond our human mortality on problems that are deeper and longer than our mortality, it is simply impossible for us to succeed. We need to take a longer view, and that means you have to have an institution and an institution controlled by the residents that can take this work and advance it decades into the future.
Lamont, any thoughts to add to that?
Yeah, thank you, Wayman. Wayman always does a good job of bringing the history and the deficiencies in our system. But just currently, I think we have the resources to take care of this. There's been money through the American Recovery Act, where we have billions and billions of dollars that's available. We have housing tax credits. We have capital gains exclusions. We have all of these perks that we give to the rich folks, but we don't give it to people of color and poor folks. And the only way we're going to solve some of these issues is moving the needle on the income of people who are in these situations. And so we need to make some policy changes, reallocation of wealth, and make sure that people have such a basic right to be able to have housing choice. And housing choice doesn't necessarily mean that everyone should be a homeowner, but they should be able to live in decent, affordable, quality housing of their choice. And whether that's in the neighborhood of opportunity, where there's ample jobs and other resources, those things work. My sister left Milwaukee and moved to an affluent county just outside of Milwaukee. Is Waukesha County, one of the wealthiest counties in our state. And her life has been completely transformed. And so, people, but that's, people of poor people don't move very far. They usually move up the road. And that's what we're seeing in Milwaukee. We're seeing one neighborhood grow and the next neighborhood become burdened. And so some of these policies have to change. And we really need to look at how we're going to increase the wealth of people who are most affected by these policies.
Great, thanks. So we have a question in the chat from Matt Hoffman, who has also been working on this initiative. Matt's asking if the two of you could speak a bit about what the residents of the Parks Community Initiative and other neighborhoods are seeing from their perspective in this process, how they feel, what they're looking for, how they can specifically engage in this transformation that we're talking about here. And how do we bring in the people and the resources that are now in the suburbs to supplement this work?
Lamont, why don't you take that question?
Well, one of the slides that we show for reason is about the cap rates. So, you know, you have these houses who are really nice houses, usually have a lot of space. They're very spacious, but people are using them to kind of over-densify the neighborhood. But what is the biggest tragedy is that the city of Milwaukee is not reaping the benefit of the tax revenue that they could be gaining, which could then be used to support programs that we need help with. And so residents are feeling a little bit disconnected from the city, from the county, as Wayman mentioned earlier. We had a pretty successful initiative where the city reached out to developers, and what they did with a lot of vacant units is they allowed the developers to get the houses, gave them subsidy to develop the houses, but then they turned them back into rental units. And when this happened, we had hundreds, if not thousands of residents saying, hey, give me that home. So the concept of urban homesteading, helping people, the sweat equity portion of home ownership, Milwaukee's totally bypassed that and has just went and said, you know what, we're not going to train people in how to do housing construction anymore. That's how I got into the industry as a young unemployed youth with no experience in housing. Those programs are slowly dying, or if they are in practice, they're usually not. I would say that they usually don't throw a wide net. They're not grabbing a lot of people into those programs. And people just feel like the city's not listening to them. And so one, they need to increase the dialogue, make sure that there is an open conversation about what should be done with the disposition of these housing stocks. And then also, I think, as Wayman said, you have to put them in control. They have to be in the driver's seat. You can't have people from the suburban areas telling people who live in this community every day, who deal with the crime, who deal with the poverty, who deal with the substandard housing, and then tell them, don't worry about it, we'll take care of it. You just sit on the sideline and we're gonna come through and help you out eventually. And that's what's been going on in Milwaukee. And so until we can get that dialogue going, we're gonna continue to have some problems. But I'm encouraged that we can do it. And this effort is really, like Wayman said, he's reached out to people throughout all sectors. We have health professionals, we have community leaders, we have neighborhood groups, all working to get developers, people who worked in government, all working together to create this solution. And I think with that collective impact, we'll have a better chance than some of the efforts in the past.
If I could add two things, I agree with most of what Lamont said. And Lamont, I regardless of what I say to the audience, I would defer to Lamont because he's on the ground, and that question really is his question. But I want to go back to this about how Black folks feel. And remember, I said that from 1980, 1990, 2000, 2010, and now 2020, 5 straight decades where African Americans were poor at the end of the decade than at the beginning. 5 straight decades, a half a century of decline in income. And so Black Milwaukee feel like it is, not only is it physically segregated, economically, the conditions that they operate in are so different. And I just asked the audience, how would you operate on income for your family on $11,000 a year? And so, and at the same time, African Americans are probably the most optimistic people, certainly nationwide, but clearly in Milwaukee, about our republic and our nation. as bad as these situations are, they're at the top of the list who are like, this is a great nation, and we're going to overcome these problems. And so those contradictions of having this extraordinary hope, and at the same time having some of the most horrendous economic and social conditions, is just extraordinarily humbling and sobering. And it begs the question, as Dr. King said, how long? How long? Because this cannot last forever. Humans can't take this forever. A half a century of poverty, and this wasn't stated. In 1960, Milwaukee was the highest income for African Americans, so high that even with a high school diploma, up until the 90s, you could graduate from high school, get married, and have a middle-class lifestyle. All of that is gone. And so people are living in conditions that I always think about the book, The Brave New World. Remember the two worlds, where the savages live? African Americans are like those people in the Brave New World. Their existence and how they have to survive. Poor to middle class, and this is important. Remember what I said. Majority of Black middle class Milwaukeeans live in the most segregated areas with six-figure income, and a fifth of their neighbors are in poverty. And virtually impossible to have those opportunities. So when Lamont talks about his sister, he's absolutely right. Those who are the few that have successfully done that, they have a much better life. But man, it can be very hard making that step.
Absolutely. So a few more questions rolling in, and thank you to everyone for adding definitions of the capitalization rate into the chat. Perfectly good question to ask for clarifications on lingo and terminology as we run through this as well. Some questions about how we engage other people in this discussion. Certainly the premise of this entire initiative is to get a seat at the table for the residents of these neighborhoods, for the minorities who are living there, for the lower income families, the poor families who are living there. So I think this initiative in itself is the push towards that. Someone was asking about how that can happen. And then also, how can we engage and incentivize the health sector to act on these linkages between health and housing and capitalize on that? So thoughts about bringing the health sector, and I would expand that to other sectors as well, who may not think about housing in this way, and how to bring them into this work.
Let me touch on that. When I was at WIDA working with particularly Milwaukee County, and they were a leader, was that we wanted to look at reducing the homeless population. I just saw a study where Milwaukee had the largest drop in homeless population, and we created a strategy really led by Milwaukee County. Our role was simply to convince our developers and our resources to support what the county want to do. And that was to integrate affordable housing with healthcare and moving homeless straight into that housing. And what was found by that work was that Wisconsin, like many other states, have a major Medicaid cost. And the state of Wisconsin has a $4.5 billion Medicaid spend, and about, I don't know, maybe 40% of the dollars, which are, again, hundreds of millions of dollars, a good portion of that is focused on the homeless. And what they found was they were these repeat users, someone who's bipolar, the police picks him up in a park, he goes into the drunk tank, and then 3 months later, he's back out there again in treatment. And what they found was that when they put people in housing and provided the services outside their front door, they did not show up in those systems, and they started seeing these significant reduction in costs. That is, those homeless individuals who were able to go into housing first were no longer the super users of Medicaid expenses. And I've argued for states that if they look closely at the amount of dollars, businesses do this all the time. If you're losing $1 billion a year, that's you're just losing it. If you could spend $300 million to build enough housing that you could over years capture that billion and not lose it, the government doesn't think that way. But the fact is that if we do not address this idea of integrating housing with services, we're going to continue to see increased medical costs. That's usually a combination of the horrible conditions of the residents in these neighborhoods where they're coming in very late in the life cycle of the disease, and increased public costs that all of us bear. And so this idea of integrating housing with services are important. Now, over the last decade, partly because of the Obamacare, created incentives to try to move people out of those high cost services like emergency. And so it creates the environment where the nexus of housing, affordable housing, and healthcare can be integrated. The point we're at in our nation, and certainly I think this is no different in Wisconsin, is that housing has its own language and its shtick, healthcare has its language and its shtick, and we're in this point of creating our translator that allow us to be more efficient. So what's in front of us is creating greater efficiency that would basically result in a more efficient cost of housing for low-income person, and at the same time, improvement in health outcomes at those people who are tending to die and to be disabled by the afflictions that affect them.
Thanks, Wayman. So Lamont, another question to you that I had. You spoke in some depth about the corporate ownership piece and the threat of that. How are some of the ways that the Advisory Council and the Parks Cooperative Initiative are thinking about countering that at this point?
Sure. So some of the discussion among these community stakeholders that we engage talked about, one is a acquisition fund. Can we create a fund that would allow us to acquire expiring tax credit properties, vacant properties that may be on the fair market, and have some money so that we can compete with these out-of-state investors and corporate investors who have a lot of money. So if we can create that, definitely taxation or regulation of the investor owner, so that money can roll up into a pool of funds that can be used in a variety of different ways. I think, the American Recovery Act, the city has already created a plan for use of those funds, and they have ample built-ins in that plan to help. I think, Wayman always is very good at challenging the norms, and I appreciate his history, because without the history, what we tend to see in Milwaukee is we repeat our same mistakes over and over and over again. And so sometimes that context to show that things are not working is very important. And I would just say that, we haven't been very successful. And so there has to be new energy, new alternative thinking for us to move past this needle. Because whatever we're doing is certainly not working here in Milwaukee.
Could I add something to that? Because I think that's important. One of the people who's on this call is the person who organized Souls to the Polls that triggered the early Republican, the vote is being cheated, because they were so successful in turning Black folks out, even in the middle of COVID. We've just begun a discussion to deal with what Lamont talked about, and that is, how can we get more citizens involved on these broader issues to put both political and neighborhood pressure on leadership, and to get more people involved in understanding what's going on. And so that leader who was able to convince people they needed to be involved in their republic and to vote, now are saying, how can we get people involved in the affordable housing and economic development space that we have been doing so poorly at, as Lamont has described. And so again, another way, and what's important about this for the audience is that, you know, I'm really kind of a finance technical guy, but I started my career as an organizer, sometimes called a hellraiser. And one of the people I worked with was early in my career was Jesse Jackson. He taught me one thing: you need two types of people who can go into corporate suites and people who can throw bricks. And when I say throw bricks, I mean march and protest and use the democratic tools that's available in our society for our citizens who are at the top of the organizational chart in our republic to speak their voice. And so you need the ability for people to push, and you need folks who help bring good ideas. We've kind of done that through the Milwaukee Advisory Council, where in effect, they're the talent. All we've simply been is their staff, but this idea of bringing community and technical together around a common problem and common issues and coming to a solution is one that you don't see a lot of. I mean, perfect example. All around the country, all these folks who participated in these George Floyd moments protests are saying, hey, we know how to figure out protests, but how do we turn that into meaningful institutional change? We don't know how these institutions work. Many of you on this call do. You know how they work. You know where the weaknesses are. You know where the opportunities are. But, you know, I grew up in Chicago. If I learned anything, they don't give one thought about you being a technical person and having the right answer. That's obviously true in Milwaukee, because Lamont and I have been at this a long time, and it seemed to have not made a difference. And so the fact that you got technical knowledge, sometimes you got to have a platform, and sometimes that's somebody else at putting that up to a level where it gets the attention of the broader community around these important issues. And so we need to have both sides, those who are legitimately raising criticisms about the state of our republic, and those of us who have solutions, ideas, and have solved problems that would eliminate the very things that triggered the protests in the first place.
Any other questions from the audience or comments on all of this? From experience, I know there are a number of people on the call from Milwaukee. Does this resonate? Do you want to share anything?
I think one comment that can't go overlooked is Janae Marino made a comment about, where is it? The first thing that must be done is recognize we need to see the value of these residents as consumers and figure out how to recycle their value within their communities. And that's been terribly overlooked. Most of us know about the studies that says the Black dollar circulates less than a day in the community, just enough to get a haircut, maybe one other activities, and that money is gone. And we have the same problem here, where most of our money that's regionally earned gets on the freeway and goes out to the suburban communities every day. And so until we can build that business infrastructure, have more mom and pop investors in the neighborhood, we're going to continue to see these problems, because there is no equity. There's no equity in the homes. There's no equity in the businesses. There's no shared equity in the community. And so we need things like cooperative structures. We need startup funds to help people get into business. We need acquisition funds so people can buy property. We need urban homesteading models so that you can buy a home and start to lay your bricks in the community. Right now, we have a bunch of people who are just disconnected from the community, and Wayman did a perfect example that, you know, we have this tale of two cities. Some people who are living very savagely at a base nature, and other folks who are trying to carve out a dream, but can't because they're still in the same neighborhood as the people who don't care about the neighborhood. So a lot of this is economics, and until we solve this economic piece, we're going to continue to struggle. I saw something that says Black households have an average net worth of maybe I want to say it was 40,000 compared to white households at 171,000. And you think about things like that, you're doomed from the start.
Great, thanks, Lamont. So we've got about 2 minutes left and a few more questions just rolled in. So we'll tackle these as the last questions. Question about if there's examples of these sorts of collaborations, particularly women that you were speaking about in the institution building in other cities that could be looked to, as well as how the academic sector, researchers, university personnel, students, people who aren't in the technical fields, how they can amplify this work and what's being done in the neighborhoods. And then also a question about, and you can pick and choose here what you want to tackle. The other question on the table is whether the city of Milwaukee and the state of Wisconsin are developing policies that incentivize or require retrofits of buildings to reduce energy costs and thereby help with utility payments and the cost of the burden of utility costs.
On that last question, in general, the answer is yes. In general, and so guys, Anya, your laugh has a reason. I sometimes describe the world we live in. I grew up reading Superman, and if you guys read Superman, you remember Bizarro Superman? Bizarro world was the opposite of Superman. So if in the real world, we know red light says stop, in Bizarro world, red light means go. Well, Black people live in an American form of Bizarro world. And so whenever you answer a question in the context of being a Black person, are you answering in the real world, or you're answering in the bizarre world that Black people in apartheid America live in? And so that's that question. But I'm going to get to that first one. The example that I participated in earlier this year in Chicago was around shared equity. It had academic, it had Enterprise Foundation, it had a whole host of groups that was focused upon how to approach a very different approach of addressing these issues of inequality and some of the same conditions that Lamont described in Milwaukee that are also true in other cities, including Chicago. And so it had academic players. In fact, one of the panels I moderated had a professor from my alma mater, University of Illinois at Chicago, who had just did a major research project on what cities are doing shared equity in co-ops, and then classifying those cities on the characteristic of their programs and the amount of dollars they provided. And again, this information was just one example of what was coming out of the university. And there were a number of academics that participated, as well as community and neighborhood development leadership. And so Chicago, in this broader area of shared equity, is one example that I've seen lately of bringing community, technical, and academic and business together to address common problems.
Thanks. Well, thank you both, Wayman and Lamont, for your contributions, not only to this webinar, but to the work that has led up to it. And thank you to everyone who has joined us today. AHI tries to host these webinars as often as we can to highlight the work that we're doing, both domestically and around the world. Just a note to everyone and a soft reminder, AHI is a nonprofit. So if you are interested in this work and you like this work and you like what we're doing and how we're doing it, please do consider offering us a donation of whatever amount you might be able to. NOAA has kindly put that link specific to the Health Secure Housing donation support in the chat. And we appreciate everyone's contributions, whether they be intellectual, financial, or just in helping get the word out about what we're doing. So thank you for joining us today. Feel free to be in touch with further questions. And supreme and very large thanks to Wayman and Lamont for your work on this initiative and the contributions today.
Thank you.